Is web interface reporting still available for the 2024 performance year?
Great question. Yes, 2024 is the last year for the web interface. Those of you who've decided to stick with it or to do CQMs and the web interface submission together will be building your last web interface submission in the first quarter of 2025. Expect the due date for that submission on the 2024 performance year data to be March 31, 2025. Now, everyone knows that Medicare can grant a last minute reprieve in 2025 rulemaking, but it seems to me to be extraordinarily unlikely. It takes effort for Medicare to keep that web interface system going. And with the investment CMS has made in the change to the APP and the CQM mechanisms, and the lack of investment in continuing the web interface infrastructure, I don't see much chance of change. Medicare may have already passed the point where it could choose to continue web interface for 2025. Now, in the first quarter of 2026, you will need to report the APP for 2025 using MIPS CQMs, Medicare CQMs, or eCQMs. Now, there are three urgent reasons not to wait until the last minute to change. Now, let me explain. In years past, we have engaged large groups in February and completed a quality submission by March 31st. But it would be foolish to count on that in this environment. Nearly half of MIPS eligible Medicare providers are in ACOs needing to make that switch to CQMs. Registries like us are expanding staff and infrastructure as we engage new clients. There will be just too much competition for registry capacity to be sure of finding capacity even in mid to late 2025. So I suggest you get yourself in with a registry as soon as you can. Second, with a mixed technology environment for most ACOs, it's not a trivial matter to get and blend data from all practices. It's doable, and we'll tell you how we can do it, but it's not trivial. It takes time. It takes time to not just to get the data, but to improve the data and make sure it accurately reflects your great performance. Third, even if you're doing a great job providing high quality care to all of your patients, your documentation is not necessarily going to be easy to access for accurate reporting. You will need time, counted in years, to steadily identify and correct gaps in your documentation. With all of your shared savings on the line, you're already late getting started.